16-109. For what purpose does the gentleman from Illinois seek recognition?
Madam Chair, I have an amendment at the desk.
The clerk will designate the amendment.
Amendment number 21, printed in Part B of House Report number 116-109, offered by Mr. Foster of Illinois.
Pursuant to House Resolution 431, the gentleman from Illinois, Mr. Foster, and a member opposed, each will control 5 minutes. The chair recognizes the gentleman from Illinois.
Thank you. And I'd like to also thank Congressman Andy Kim for co-sponsoring this legislation, this amendment. This simple amendment would add and remove $1 from the Substance Abuse Treatment Fund, which we intend as a signal that the HHS should prioritize opioid treatment money where the science shows that it actually works, on medication-assisted treatment. Unfortunately, addiction is an issue that we've become all too familiar with in our community and across the country. It has claimed too many loved ones, shattered too many lives, and broken too many families. It is a devastating reality that drug overdoses have surpassed motor vehicle accidents as a leading cause of injury-related deaths in the United States. In fact, more people die in a single year from overdoses than were killed during the entire Vietnam War. This is a public crisis that affects people of every race, every income group, and every education level. These are mothers and fathers, they are friends and neighbors. Honestly, when I was first elected to Congress, I was not prepared for the numbers and the types of stories that I heard from family members who have lost loved ones to substance abuse. The urgency of this deadly epidemic requires us to work together and work smart as a community and a nation to fight back. And it requires that we use the best available science and spend our money where we know it does the most good. We should implement evidence-based treatment options, and research has backed medication-assisted treatment. Studies have shown that medication-assisted treatment decreases opioid use, opioid-related overdose deaths, criminal activity, and infectious disease transmission. These studies also show that medication-assisted treatment increases social functioning and retention in treatment. Patients treated with medication are more likely to remain in therapy compared to patients receiving treatment that did not include medication. It is also important that in the tragic case of pregnant women who are addicted to opioids. A 2012 study by the American College of Obstetricians and Gynecologists found that the treatment of opioid-dependent pregnant women with buprenorphine improved outcomes for their babies, and the medication-assisted treatment reduced withdrawal symptoms in newborns and decreased the length of hospital stays. Medication-assisted treatment works, and it's what we should be funding. So I urge my colleagues to support this amendment and reserve the balance of my time.
The gentleman reserves the balance of his time. Does any member claim time in opposition? Seeing none, the gentleman from Illinois is recognized.
Well, I'm now honored to yield 1 minute to Chairman Rosa DeLauro.
Thank you. I rise in support of this amendment. As noted in the report accompanying the underlying bill that we are considering, relapse following opioid detoxification is a contributing factor to the overdose crisis. Medication-assisted treatment provides a whole patient approach to the treatment of substance use disorders, especially opioids. In combination with counseling and behavioral therapies, FDA-approved medications are used to treat substance misuse, to prevent relapse, and to sustain recovery. This amendment calls for the prioritization of funding for medication-assisted treatment at the Substance Abuse and Mental Health Services Administration. As part of our commitment to support people to enter into treatment, to be in sustained recovery, medication-assisted treatment is an effective option. I urge my colleagues to support this amendment. Yield back.
The gentlelady yields back. The chair now recognizes the gentleman from Illinois.
The opioid epidemic has claimed too many lives and torn apart too many families for us to be using anything but the most effective treatments. It is past time that we stop treating opioid addiction as a moral failing and start treating it like the treatable medical condition that it is. I urge my colleagues to support this amendment to make sure that HHS prioritize funding for medically assisted treatment and yield back the balance of my time.
The gentleman yields back. The question is on the amendment